We've discussed the creation of a health insurance exchange on the program before, but today we're going to get an update from the new man in charge. We have Minnesota Management and Budget Commissioner Jim Schowalter. Thanks for joining us today.
Thanks. Good to be here.
Commissioner, let's begin with you recently took over the task of leading the task force group that's creating this healthcare exchange, health insurance exchange. Has this for you been kind of a baptism by fire?
Sure has. And it's an exciting baptism because really the project has grown over time so that it's gone from just an idea that we were trying to get going to a full-fledged team of people that have been working with the Department of Commerce that will be now working with Management and Budget. And their job is really to stand up a very large operation that will hopefully help serve Minnesotans by simplifying the health insurance options, helping individuals and small businesses get access to health coverage at affordable costs.
And this change in command comes with just a couple of months before the recommendations are due, and we'll talk about that in a minute, but first, let's talk a little bit about this change of command. And according to the September 24th St. Paul Legal Ledger Capital Report, there was some discontent among some of the stakeholders, like the Chamber, regarding transparency and divulging information that affected them. So, is that what precipitated the governor placing you in charge of this task force? And if so, how have you addressed that?
What we really are trying to do is make sure that all of the state agencies have their roles clearly defined. And I think the governor was really clear about the conflicts that were there with the Department of Commerce and regulatory matters that they had to do with the exchange. And now we're actually building a business that they're going to have to regulate. And at some point, we were going to have to make a change. Also, I think it's really important to recognize that the health exchange isn't going to be a state agency. I don't know that anybody really wants it to continue being a state agency over time. So this is just the next stop for the health exchange. In time, hopefully it'll be a public-private entity, something that's more independent from all of the state agencies.
You've been touring the state discussing this issue. What have you been hearing from people thus far?
I think it's a huge issue. And
do people understand it?
No, and it's something that it's because it is a complex thing. It's part of a federal health reform bill, and probably the one thing that everyone does get, and I think actually everyone agrees on, is that the state has an opportunity to do something special. That the state could just opt and say, yeah, we're not going to take this one on, we'll do a federal health exchange. We know that'll be created, we'll just take whatever they do and we'll figure out all the problems that happen with it. But that's not really the Minnesota way. And we've got a responsibility as a state to take advantage of the expertise, of the information that we have, and really make something that works for the state. And really the exchange blueprint is trying to create that document so that everyone understands what that path will be, what are the specifics, and hopefully answer some of the questions that have been percolating up over the summer.
Now, recommendations from the task force are due in just about a month. Mm-hmm. How much work do you think there's left to go? What's the learning curve been for you, and how do you get this blueprint together in time?
Fortunately, there's a lot of really smart people working on this. And so while I have to get up the learning curve, the workforces, the task forces, the working groups have experts. We have experts from all segments of society giving us their ideas, giving us their perspectives on these various ideas. Some of them, everyone comes to the same point, yeah, this is what we should do. Other pieces are controversial. They're just controversial by their nature, and we're going to have to get those resolved. Fortunately for us, the federal government isn't making us resolve those things by middle of November. We've got a little extra time. That's really critical, and as the governor indicated, that'll give us a chance to continue to engage with the task force members, but especially with legislators, with stakeholders, and ultimately get something through the legislature in January.
And we've been speaking fairly ambiguously thus far. How can you kind of articulate a little more specifically for our viewers what they can expect, whether you're a Minnesotan or a business person who might be providing insurance to your employees? What do you think at this point can people kind of expect?
What they can expect is a website that will give them an opportunity to find, compare, and choose health plans that work for them as individuals or small businesses. There will be the ability to filter and find plans that work for them, and there will be an ability to understand different levels of quality or different levels of cost so that people can start to compete. By people, I mean plans can start to compete on quality. They can say, okay, here's what we've got, here's the plan that we've got, but here's the information about the results that this plan creates. we can start to use some of those unique advantages in Minnesota, and that's what we're trying to create.
Does this, you mentioned it'll primarily be done via website, so does this kind of inspire, for lack of a better word, a sense of fear among people who are not tech savvy? Because there are still plenty of people out there who can't even text.
Probably, and I get that. And that's why, we know this is an incremental process. We know that there are going to be people who are going to be necessary in the communities to help people find their way into the exchange, help them assess their options, understand those choices. That's going to be part of the plan in the end. How we make that decisions or how we make those things, that's what the working groups and the task forces are all about. Commissioner,
what expectations did you have when you found out that you were now going to be in charge of this, and are you realizing those?
I wasn't sure what I was expecting. I knew that this was a big project. What I didn't understand, and what I've realized, is just the amazing people and energy that's around it. And it's one of those issues where, there's political differences, there's outlooks, and people expect more or less, but in the end, it's just an amazing project that includes technological issues, includes fierce political issues and policy issues. But in the end, I think everyone kind of gets to the same point as saying this is an opportunity for us to do something that works for the state. We all know that the federal government is bigger, gets to set some of those rules. We're going to have to figure out how to comply within those rules. And the more that I talk to people, despite all the differences, the more I find that there's some common ground that we can work on.
And you touched upon my last question, the political differences. There have been some legislators who have been vehemently opposed to this idea. Are some of them coming on board at this point, or do you find that, this could be a tough sell if it's a Republican-led legislature next year?
I'm sure it's going to be a tough sell for some people. This is a change. This is a big change in how we approach insurance, how we approach insurance as a state and as a nation. So I am sure there are going to be some people who, in the end, won't support it. That's okay. I want to make sure we have the issues framed up so that people know what their choices are. And so that when we get to the legislative session, the governor can have a recommendation out there that's very clear, hopefully brings a lot of people along, and we can have a good debate about what we're going to do.
Okay, Commissioner James Schowalter, thanks so much for coming in and discussing your newest task. We appreciate it.
Thank you.